Bruxism. Why do you grind your teeth at night? Bruxism is the medical term for the grinding of teeth or the clenching of jaws, actions often performed unconsciously. It can occur during the day or at night while sleeping. It is more than just a nocturnal nuisance. It's a common condition that can lead to significant dental health issues if left unaddressed. Various intrinsic risk factors and external causes contribute to the occurrence of bruxism. These are predominant triggers for bruxism, with many individuals subconsciously clenching their jaws or grinding their teeth as a reaction to anxiety, stress, depression, or frustration. There is a hereditary component to bruxism, as studies have shown that it can run in families. Approximately half of the individuals with sleep bruxism have a close family member who also exhibits the condition. Structural abnormalities in the alignment of teeth or jaw can lead to bruxism. Children, in particular, may experience bruxism when their teeth are growing or if their bite is not properly aligned. Habits such as smoking, heavy caffeine consumption, and alcohol intake have been linked to an increased risk of bruxism. These substances can alter sleep patterns or increase muscle activity in the jaw.